visual exam, we use the camera. Okay, this is a multi-purpose camera that connects via Wi-Fi to the mobile device. Okay, so first what I'm going to do is I'm going to connect the camera. I'm going to the settings of my phone, and I'm going to the Wi-Fi settings. I'm going to turn on my Wi-Fi, and then I'm going to find the code from the device, and I'm going to select it. So it's already, in this case, I've used this before, it's already selected. Okay, so once it's selected, so I'm going to pick the camera application. Okay, so here's the camera application. So now you can see. Okay, so if I go, can you come a little closer about this one? Okay, so I could have, this is the electronic box, and this is the camera. So the electronic box can be in my pocket. Okay, so what I could do is, so say Balthazar had an issue with, okay, the skin. So I go here, okay, and then I'm going to then focus, okay. I'm going to look at the little mark right here. Okay, I'm going to zoom in on it. Okay, I'm going to take a picture. Okay, I'm going to zoom in, take a picture. Okay, or then I can go and check, say, there might be an issue with, you know, there might be an indication of infection in the ear, right? So what I could do, I could go to the ear, okay, okay. So now I'm looking at the ear canal, okay. I'm gonna take a picture of that. And I can do the same thing for the nose. I can do the same thing for the, you know, the mouth. There's actually another piece that's actually just for the mouth, right? Where you can, it has a little mirror in there where you can actually look at different, you know, crevices of what's happening between the teeth. So I'm going back to the app, and what I'm going to do is I'm going to import these pictures that I just took. Okay, so first I'm gonna go choose from library. Okay, so I'm gonna go here. So first I'm taking the good picture of the skin, right? So I'm gonna choose that. I'm also gonna choose then the picture of the ear canal. Okay, I'm gonna choose that. So now I have these two pictures. I can also add notes. And then now, what the patient, what the dermatologist or whoever it is on the other side would actually see those two pictures. And then here I added the note, please check the black spot on the skin. They can go in and zoom in and make a visual sort of diagnostic decision. And then last but not least, you have recorded results. It's basically all of the encounters that we just did today are stored in recorded results. All of the encounters or exams are scored chronologically by date. Okay, so we did the vitals, we did the auscultation, we did the 3D CG. Okay, I manually put in the blood glucose, I manually did the urinalysis, and last I did the visual exam. I can go in a particular exam and choose that. So I can go in urinalysis, okay, which is what I selected, and then the PDF then will give the selection and then what that means for that particular chemical in the urine. I can then print a PDF, or I can send an email of the whole composite of all the exams that we just took to a medical professional, or I can view a PDF of it. We're downloading a PDF. It has a cover page. It has the first thing we did, which is the vitals. Then we did the auscultation. Then we did the ECG by itself. Then we manually entered the blood glucose. We entered the urinalysis. Then we did the visual exams. Again, these encounters are then mirrored as part of the physician portal, so that if the person administering the exam does not have the proper training to make a diagnostic decision, someone remotely can actually be looking at those exams as they are being administered to make a diagnostic decision, thereby neutralizing the lack of access to medical professionals, the lack of access to care. If you can come here so I can go and so you can take a quick look of what's happening on the physician.